Welcome back, friends. Welcome to another video lecture by Kami Biology. Today in this video lecture we are going to talk about replication of the arboviruses, which usually cause the chikungunya. In the previous video lecture we talked about the epidemiology, introduction, we talked the transmission, prevention, everything related to the chikungunya. So how these viruses are replicated, these arboviruses are replicated inside our body. These arboviruses usually infect the endothelial, epithelial, monocyte, derivative macrophages and primary fibroblast. So these are the cells which are usually affected by the arboviruses. Then we have replication schemes. What actually happen in this case? First of all, the viruses are get internalized inside our body through the bite of the mosquito. Once it is injected inside our body through the mosquito, then it travels inside the bloodstream and reach to the target cell. Let's suppose a target cell of any of them, the target cell maybe. Now once they reach to target cell, then there is no specific receptor. There is the receptor are present, but the receptor are still not identified. Now they bind to the receptor and internalize through cell endocytosis mediated pathway. Once they are get internalized and through endocytosis mediated pathway, then they make endosomes. So this is the endosome. Now after that, the pH of the endosomes is acidic. Slightly the pH is acidic, due to which the nucleocapsid and capsid protein are removed or disrupted, and finally we get the positive mRNA. This positive mRNA can synthesize the non-structural proteins. Non-structural protein use this positive mRNA as a template and produce the negative mRNA. So they will secrete the negative mRNA. From the negative mRNA we get more positive mRNA, and from the positive mRNA we get more structural proteins, and these are the envelope protein, capsid protein, nucleoprotein, and we have the 6K polypeptide proteins. After that, these mRNA, positive mRNA and these structural proteins are assembled together and they make the nucleocapsid as well as the capsid portion. Now these viruses are then transferred or passes from the endoplasmic reticulum and then from the Golgi body, and then they get the envelope. This green one represent the envelope. Now once we get the envelope, still there is no spikes, means these spikes are not present. Now they get the spikes from the host membrane. They fuse with the host membrane and finally they will released out through budding. Okay, then they will release from the host cell through budding. Now after some times, once it is released out through budding, then what actually happen? This viruses is get matured, and now the viruses are get mature and it is ready to attack another host cell. Okay, this is how they can perform their replication process. Then we have the treatment of this chikungunya disease, that how we should treat ourselves from the chikungunya disease. As it is the viral disease, so there is no antiviral drugs are available, and we should avoid ourselves from two drugs. These are the steroid anti-inflammatory drug, and we have aspirin. We don't provide these drugs. Why? Because once we provide this steroid anti-inflammatory drugs to the patient, so it may have the risk of the bleeding as well as Reese syndrome, means encephalitis cases may be happen. And we don't give aspirin in this case. Once we provide aspirin, so some of the area of the body are become relaxed, due to which the viruses may get advantages and they will affect the other organ as well. So this is the chances. Then what kind of drug we should provide? We should provide those drugs which can just reduce the sign and symptom, which can just relieve the pain, or just those sign and symptom in which the patient didn't feel well. Okay, so we usually give the furin inhibitor drugs, favipiravir, arbidol, ribavirin, interferon alpha. Okay, these are the drugs which we should give. Now another drugs we should also give to the patient when they have chikungunya disease. These drugs are called as antirheumatic drugs. Rheumatic is a disease in which there is a stiffness and pain in the muscle. So for this disease, we should give the sulfasalazine and methotrexate drugs. Okay, so these are the replication scheme of the arboviruses, and these are the treatment of the chikungunya disease. Okay, now once we provide these drugs, then there is immunity is activated, means innate immunity and adaptive immunity is activated. Okay, and after that the process or the disease will be under the control. So that's all about, and I hope you get the idea. And stay tuned, because in the next video lecture we are going to talk about the life cycle and diagnosis, sign and symptoms of the chikungunya. Thank you so much for watching.